Assalamu alaikum. Today we're going to talk about an issue that we have faced today in the clinic. The patient had multiple anterior teeth being crowned, and the material being crowned with was Emax, and the patient had previously had an endodontic treatment for the core of the tooth. So the tooth has been endodontic treated. It still has enough ferrule of the dentine, but the idea is that the color of the tooth is discolored. Now the doctor placed a crown over it, and still the grayish shade was concentrating around the middle core area and around the gingival area. And definitely, because Emax is from one of the aesthetic material, and part of its aesthetic, being aesthetic is having a translucency, a natural translucency. So because this is thinner in thickness, it becomes more translucent, so it shows more of the opaque tooth. Okay, so my discussion was with the student, do we use trial cements or not? I want you just to note that the trial cements grow, okay, trial cements, these are a variance of opacity, okay, gradient from opaque, maximum opaque, to the translucency, maximum translucency, okay? So the gradient is an opacity gradient, doesn't add any color. In her case, we also added the most opaque trial cement and watched the tooth. Still the grayish color was still showing through, even with the opaque cement, and we chose it. So it's not an issue of opacity, it's an issue of color. We need to mask the color. Now usually with endodontic material, what causes the discoloration in these? Either there are remnants of blood products, okay, or sealant material. Sealant material is usually discolored very usually, or remnants of the getaberk, and we'll get a reddish color with it, pinkish, grayish. Then we have external resorption if some of the blood products have integrated into dentinal tubules. So multiple reasons for discoloration. All of these come from the endodontic treatment process. Now, it's easy to eliminate most of them because you can simply remove any material in the coronal part of the pulp chamber, okay? So you have to make sure none of these material are present in the coronal part. The coronal part are filled with the composite or the core material you're filling with, okay? So endodontic material, being a sealant, being a filler, being a cement, all of these can be eliminated. What cannot be eliminated if the color has gone integrated into the dentinal tubules, and you cannot remove if there is some discoloration from drugs and so on. So these two types of discoloration cannot be removed by just simple cleaning, okay? These need special bleaching procedures. And you have learned multiple intracoronal bleaching techniques. I'm not going to go through that, but if a tooth it has some opacity problem, I would go for bleaching, internal bleaching, and reduce the color by that in the dentinal tubules. The other option is, and this is more conservative because bleaching has its problems as well. We have external resorption, we have tissue toxicity, and so on. We have problems with the bleaching itself. The sealing of the endodontic treatment with the not bleaching the bleaching material inside the corona, the radical part of the root. All of these are problems. So why might not take another more conservative approach? The more conservative approach I suggested for the student, which you can do on your own, which is concealing. Now concealing is a different issue. So I have taken out material from endodontic material. I'm sure I cleaned that, but I don't want to go to bleaching. How do I do concealing? And if a crown was going to be placed over it, porcelain fused to metal, we know that the metal is covered by the opaque, and suddenly we don't have any effect of the tooth color, no matter what tooth color beneath it is. So if you're going to use a porcelain fused to metal crown and bridge work, it's enough just to cover it with opaque, but make sure that you have a porcelain margin in the aesthetic fold. So that solves the tooth. The other thing is if we're going to use aesthetic material or ceramics like lithium disilicate or Emax, which is a porcelain type. So this is where the issue comes. So my advice for you, you as a prosthodontist, please bring a caries tooth, okay? Prepare on that caries tooth, various degrees of caries, prepare a finish line, a correct finish line. Okay, so prepare the tooth. You and your technician work with playing with the stains. What are the stains that cover underlying color? It works similar to the concealing that we do with makeup. And there are a lot of makeup videos where they conceal a mole, they conceal some tattoos, they conceal lesions, they conceal blood vessels, veins, and so on. You have multiple issues with tissue, even scars. They know how to conceal it with makeup. It's the same idea. What is the idea? There are colors that contrast the color of these stains or the pigmentations of the skin. The same thing we could try with our technician. So, one of the rules, green removes redness. Okay? It conceals the color. They work together, they interact with the color of each other, where this can cover redness. If it was peach and orange cover blue or purple shades. Where we can find purple shade in teeth with tetracycline, for example. Okay. Yellow could be used to add brightness. So if I want to add brightness to the tooth, brighten the tooth, so it's not the color. I just want vitality. I want to change the vitality of the tooth. I could add yellow as a stain to give this vitality. Lastly, lavender. It could remove the yellow undertone. So what do you do in this case? Once more, this is a discolored tooth. You know it's discolored. We're going to remove the caries. We're going to ask the technician, play with the colors, do multiple crown trials with a thin margin, anterior margin, and see what combination of these stains do we put and add to the mixture. This is for handmade crowns, okay? So it's not a pressed type. It's not a pressed ingot. It's a hand-built layering technique. This also can apply if you're going to use zirconia. If this if the monolithic material, you're going to choose some stains that counteract these internal tooth stains. This is more conservative. So the idea of concealing in dentistry applies like in makeup. Adding stains counteracts the color, the underlying color, rather than just covering it by opacity that sometimes doesn't give you the final shade you want. Thank you. Thank you very much.